This one's disturbing. A woman is suing a Portland hospital claiming their practices resulted in the death of her baby. A woman in Oregon is suing a hospital after she accidentally suffocated her baby only 4 days after his birth. She claims she was left alone, heavily medicated, and unsupervised to breastfeed the newborn. After an hour, she woke up to find her child unresponsive. The baby was transferred to a NICU in a separate hospital where doctors determined his brain damage and comatose state would not be reversed. The baby was only 10 days old when he was taken off of life support. Should the hospital be held responsible, or is this simply a tragic accident? Well, wow. It is tragic, no matter what. When I first read this case, I was devastated for this baby, for the mother, the circumstances surrounding it. But really quickly, Ariva, from a purely legal perspective, does the mother have a case here?
She has a fantastic case. There are so many studies that make it very clear about how unsafe it is for infants to sleep in the beds with mothers. But this case is really galling to me because this woman had a cesarean section, a C-section to deliver her baby. She's on pain medications and apparently some kind of sleep medication, so she's groggy. She's in pain.
And a very
for a
strong
nurse,
painkiller, opiate, Norco, I mean, very, very strong stuff. She didn't know what was going on. To be left alone with the baby, unsupervised.
Yeah. And you have a nurse who's held to a standard of knowing what the risks are of putting an infant in a bed with a mother in this condition. And from the facts that we are being told, they didn't check on this mother and this infant for over an hour. And I think this family, this mom, will be able to prove that it was foreseeable that this kind of death could occur if this baby is left in a bed with this mom.
I agree, and what I have to say is, as a provider, you can never really understand how powerful these medications are. When I recently had my surgery, after the surgery, I was on multiple medications. Apparently, I had almost an hour-long conversation with the doctor, with other people. Zero recollection of any of it.
Yeah.
And so, from the patient perspective, I have a newfound respect for how truly out of it you can be. I think leaving the mother, period, at all in this scenario with the baby when she's on those kinds of strong medicines is very,
well, you
very
question
dangerous.
why the baby was put in the bed with the mother. I've nursed 3 kids. And after childbirth, you are just out of it. So even having your baby, if you're not on pain medication, let's take the pain medication away. Just the rigors of childbirth.
Right. You're exhausted.
You're out of it. You're out of it.
So from an OB-GYN perspective, I will tell you that we are big on bonding. So we do like moms and babies to spend as much time as they can together. So that's why moms will be with babies. But I worked in a lot of hospitals. So from Alaska to upstate New York, and I will tell you in a lot of hospitals, it is, if we walk into a room and a mom has a baby in a bed and that mom is sleeping, we will ask the mom to remove the baby. Like, it's against the hospital's rules for that to happen. And I will tell you, some moms get very upset because they want to sleep with their babies. They love their babies, and then you explain that it's very easy to roll over and suffocate a baby. In no instance should a mom, a brother, a sister, an aunt, an uncle, a dad, nobody should be sleeping in the bed with your baby.
And that's what hopefully this lawsuit will do, is raise that kind of awareness and help educate mothers who have the best intentions of bonding.
Because these cases happen. I mean,
well, 3,500
we've talked about it
a year are dying from suffocation and SIDS because of unintentional poor sleeping habits. You know, you want to bond and you think it's so lovely and you have a little picture of the baby.
And that's a good reminder for new parents at home, whether it be the father or mother. Once you take your baby home, if you're on any medication that's a sedative, it is best if you are not laying there with your baby in case you fall asleep.
Yes.
This is a tragedy. We did reach out to the hospital. They responded in part. Our hearts and prayers are with the family who lost their baby 5 years ago. We encourage parents to always follow the newborn safety guidelines and recommendations of the American Pediatric Association.